One of the things we hear most commonly from our patients, especially after we've done a consultation, is, I wish someone had told me this before. Why hasn't anybody ever told me this before? And occasionally they tell us with a hug, that this is really cool, and we have the opportunity very often to literally change people's lives.
Our mission at Link Dental is to help patients achieve the highest quality of life by helping them achieve their dental goals of comfort, function, and beauty in a way that's most appropriate for them.
This is the first time I've smiled in 10 years. For 10 years I did not smile, I could not eat, I was self-conscious, I hid my mouth all the time. I can't say enough good stuff about Mark and Jean, but this is like the coolest. I don't even consider it a dental office, I consider it an extension of my family, so to speak. I mean, these are good people and they do unbelievable work.
In the ready, shoot, aim world that we live in, there's basically three reasons why patients and clinicians participate in bad outcomes. One is a failure to make an accurate diagnosis. Two is a failure to make good informed decisions and make good choices. And three is poor execution. So what distinguishes or makes what's different about Link Dental is that we are very deliberate about avoiding those pitfalls.
The treatment here has really just improved my life significantly. I was having constant headaches. I was taking Advil all the time. I couldn't eat. I'd lost about 35 pounds because I wasn't able to eat a whole lot of different kinds of foods. Unfortunately, I've gained weight, but that's okay because I'm headache-free, I'm pain-free, and I actually like to smile now because I think my teeth look great.
The most common feedback that we get from patients is that they are very, very satisfied and appreciative of the care that they've received here. The second most common bit of feedback is patients are surprised by the amount of time we take in the initial exam and the consultation, really making sure that they understand all their treatment options. And I would say the last thing that I hear a lot, and that kind of tickles me, is that patients say, I've never had anybody try to talk me out of treatment before. I want to achieve the optimal goal, but I want to do that with the most limited amount of biologic cost and financial cost, frankly. Patients appreciate that.
What makes Link Dental unique is that we're much more than tooth doctors. By virtue of our background or our education, we understand how what happens to our teeth is very often related to the way our teeth fit together relative to our jaw joints. We understand that how periodontal disease can negatively impact cardiovascular health. We understand how degenerative changes of your jaw joint might end up obstructing your airway while you sleep. And finally, we understand that as important as it is to be able to fix what's wrong, it's also important to be able to identify what's right and to not change that, and to prevent you from getting into situations that require treatment.
I am especially proud of the execution of the work that we plan in this office. While the plan cannot be overemphasized, that is very, very important. Ultimately, somebody has to actually do the work. And I would say that a crown is not a crown. It depends very much on the care and the meticulousness of the person who actually does the work. And we just pay meticulous attention to getting it done right and to getting it done right the first time.